I'm pleased to be here with my colleague, Senate President Pro Tem Darrell Steinberg, as we announce our intentions to travel to Washington, D.C. to meet with federal officials regarding the health care reform implementation and also the California budget. I want to be clear that we're not going to Washington, D.C. to ask for a bailout of California. The challenges facing our state stem from many factors and must be solved by us here in California. The purpose of this trip is to work with our partners in the California Congressional delegation and the Obama administration in specific areas where California can legitimately make the case for increased federal assistance. We will also discuss our efforts to implement federal health care insurance reform to ensure California can begin to take advantage of the newly expanded coverage and patient protections. With respect to the budget situation, we'll be meeting to discuss several issues. First, we'll be asking for a speedy extension to the enhanced federal medical assistance percentage, which will expire on December 31st. Well, there's broad-based bipartisan support for this 6-month extension. There's been a delay in passage due to needing to find sufficient revenues to offset this. Like most other states, California had assumed getting this 6-month extension in its upcoming budget. The value of this to the state of California is roughly $1.5 billion. We will also be discussing recouping federal funds for Californians who were mistakenly denied Medicare coverage by the federal government and were instead placed on Medi-Cal programs. This is worth $700 million in one-time savings for California. The delegation has been instrumental in the past at increasing funding to the state criminal alien assistance program to mitigate the cost of the state that we incur from incarcerating undocumented persons. Well, we're encouraged that President Obama has included $330 million in his budget in this area. California's costs alone amount to roughly $880 million annually. Finally, we will ask the Center for Medicare and Medicaid Services for approval on a hospital provider fee recently enacted with the support of California hospitals. These are all areas where our delegation and the Obama administration have been supportive in the past and where we hope the federal government can aid California as we seek to close out our deficit. I'm also very eager to be meeting with Secretary Sebelius to discuss the implementation of health care reform in California. I believe that the new federal law will provide many benefits to California, and I'm very pleased to have introduced AB 1602, which seeks to implement several of the key consumer protections into California law. I'm confident that our trip will be a productive one. Similar meetings in January with Secretary Sebelius and subsequent lobbying by our congressional delegation made the difference on one of our HHS issues and garnered roughly $675 million for the state. I believe that our congressional delegation will continue to stand up with us on behalf of Californians and will continue to serve as partners as we find solutions facing for the challenges facing our state.